Thank you so much, Amy and Natalie, for inviting me, and thanks, Amy, for that really kind introduction. You know that you are very special to me. So it's a great privilege to speak with you all today. This is meant to be really informal, and I will keep this relatively brief, as I think that the discussion will be more interesting than anything that I have to say. So I've been asked today to speak about products that are available to manage bleeding amongst women with bleeding disorders. I think, though, that it's important, before I go into what products are available, that I speak to some of the lived experiences amongst women with bleeding disorders, and also address barriers to care in that context. Because of course I can sit up here and list all of the factor concentrates that are available, and I can talk about tranexamic acid, and I can talk about DDAVP and intravenous iron. But if the care is never provided, or if access to care is limited, then I can speak until I'm blue in the face and it doesn't mean anything. So I think first and foremost, we need to speak about issues pertaining to the lived experiences amongst women like yourselves, and also barriers to care that are very alive and well, unfortunately, all of which I believe very strongly are symptoms of structural sexism that exists within medicine. So I wanted to call your attention to two fairly recently published papers in the Journal of Thrombosis and Hemostasis, JTH, that are freely available online. So you can access them on PDF automatically if you Google it. If you Google the name Sumeda Arya, so her last name is A-R-Y-A, her first name is Sumeda, S-U-M-E-D-H-A. She's a wonderful hematology resident that works with me. A few years ago, she came to me with an interest in conducting research that addresses issues of health inequity. And so, being inspired by her personal research interests, I said, well, I have an idea for a sort of larger research program that could address health inequity as it pertains to women with bleeding disorders. And so we started with something called a scoping review, where she systematically evaluated the existing medical literature to see what type of data was out there describing the experiences of women with bleeding disorders, and if there was any literature that described barriers in access to care. We were both shocked to find very, very, very little describing the lived experiences of people like you. And so from that, we developed a larger research program that included surveys that were disseminated via CHS, and also qualitative interviews, where we interviewed patients, maybe some of you on the call today, and then, using the help of a qualitative methodologist, reviewed the scripts that we obtained from all of the interviews, and evaluated and pulled out common themes. And so the first paper looks at lived experiences of women with bleeding disorders. And this article was entitled, "Everything Was Blood When It Comes to Me." And that was a direct quote from one of the patients who was involved in the qualitative interviews. And it's then described as understanding the lived experiences of women with inherited bleeding disorders. And a few themes came up. One was uncertainties surrounding the diagnosis. So it seemed as if it took a long time for patients like yourselves to be diagnosed. Also, that women seem to conceptualize their experiences through their family history of bleeding. Also, the intensity of bleeding symptoms seemed to be a common theme, and there was a strong sense of normalization of a lot of the symptoms. So women, as you all can agree, I'm sure, we don't often talk about vaginal blood loss. It's highly stigmatized culturally, and maybe even more stigmatized amongst certain racial and ethnic groups and cultural groups. So it seems as if there were a lot of people who are suffering in silence. And also the impact of excessive bleeding, not only on a person's daily life, but also on their identity. So this was really eye-opening. This paper was really exciting in that the editors-in-chief, one of whom you all know, I'm sure, well, is Dr. David Lillicrap from Queen's University. They were so pleased with the research that the prominent figure of the paper was put as the cover of the issue of the journal that it was released in. And that's a really big thing, to have your the figure of your work be included on the front cover, because it means that the medical community is listening. So that was exciting. And then she moved on to her second project, which was to describe barriers in access to care. And so this paper was entitled, again, a direct quote from a patient, "They don't really take my bleeds seriously, and it's barriers to care for women with bleeding disorders," again, in the Journal of Thrombosis and Hemostasis, which is the highest impact journal for medical journal for thrombosis and hemostasis. And here, the themes that emerged were lack of healthcare provider awareness, dismissing of symptoms and dismissing of the diagnosis, limited access to specialized care and to care plans, and also a strong need for self-education and self-advocacy. And so you are all here tonight because you embody the very last theme right there in the self-education and self-advocacy bit. So I think that first, it's important that we talk about these things, that we make noise, because if we don't, then we're never going to be able to do better for patients just like you and for your daughters and granddaughters and nieces. So we really need to do better. So of course, there are a bunch of products for all of these specialized disorders. But if we don't believe that vaginal blood loss is something that needs to be addressed, and if we don't talk about it, then nothing's ever going to change. So to that effect, myself, along with many wonderful collaborators in Canada, including people like Paula James and Sue Robinson, are or have already developed a randomized controlled trial that is called Empower. And it is a randomized controlled trial that will start as a pilot phase that will compare normal saline to Wilate for prophylaxis for heavy menstrual bleeding. You might feel shocked to say, really? We haven't already studied the effectiveness of a VWF containing concentrate on vaginal blood loss for women with VWD? The answer is no, it has never been conducted. So that's a problem. And that's another indicator of structural sexism. The most common bleeding manifestation amongst women with von Willebrand disease is heavy menstrual bleeding. We've never conducted a properly designed study to support the use of regular prophylaxis for vaginal blood loss. And so one thing that I really hope for in my career, and I hope it happens sooner rather than later in my career, but I hope that we have listed indications on current products for prophylaxis for vaginal blood loss. I hope we use the term vaginal blood loss and don't use terms like women's specific bleeding. And I hope we don't say things like sanitary products. Like, we should just talk about things as they are. I actually just reviewed a paper this past weekend that was submitted to a journal that described vaginal blood loss as women's specific bleeding, which I mean, that's just not okay. We have to be talking about things as they are. So, and if that's coming from the healthcare provider, how can the patient feel comfortable? So this trial is one that is going to compare normal saline, so it's placebo, compared to Wilate. And we are looking for 10 patients in each arm, so over 4 cycles. And so we're going to compare women in either arm, and then they're going to cross over to the other arm. And very simply, we're going to look at the pictorial bleeding assessment chart score. in women who are treated with VWF concentrate versus not. I'm really excited to talk about it with you all today because I know while it doesn't sound appealing to not have your vaginal blood loss effectively addressed, with a placebo, with normal saline, of course, we don't expect your bleeding is going to improve with that. I think that this could be a really important step for women overall. And I think that it is the type of evidence that we need to move the field forward. And also, if a woman has excessive bleeding while in the placebo arm, of course, we can still give rescue therapy and give VWF containing concentrate and tranexamic acid and et cetera, and we'll just capture that information. So that's just the difference that we would do in the trial. So we're just going to gather that information as opposed to not, which is what we're currently doing. So if anyone has any interest in being involved in this clinical trial, we're going to start the trial probably just at St. Mike's and Kingston initially, but we're also going to be opening it in Halifax and likely in Vancouver as well, and potentially also in Manitoba. Ultimately, we hope that we can conduct the definitive trial that will likely need to be international, where we can enroll patients beyond Canada. So of course, of all the blood products that are available. The trouble is we just need to get access to them. And the only way that we can do that is with systematic change. And I do think that we need to partner directly with our patient partners to make that happen. So maybe I'll stop there, and I'm happy to take any questions.